Hello, welcome to Module 3, Databases for Knowledge Discovery. The learning outcome associated with this module is to use existing data sets to answer research questions about a population or topic. And essentially, you all have already engaged in this with the literature databases that you've been using to either support your research or find more about the significance of your idea or the reason you need to answer a particular research question, whatever the case might be. But that same notion, that idea of searching databases for knowledge, you've certainly been engaged in. Now we're going to spend some time discussing secondary data analysis, which is certainly you spoke about research appropriate for dissertations, and there are many people that have engaged in secondary data analysis at the doctoral level and beyond to gain answers to their research questions. So we do have a lot of data at this time that we're working with, healthcare related public health data. So a lot of secondary data analyses can be done with the data sets that exist. So I just want to speak just a little bit about what secondary data is. So you may hear the terms primary data and secondary data. So in public health, nursing, medicine, there's a distinction between the primary and secondary data, and this really depends oftentimes on the relationship between the person or the research team that collected a data set and the person that is analyzing it. So the same data set that could be primary in one analysis would simply be secondary in another. So now there are cases where a researcher may be in the process of collecting data, whether it be quantitative or qualitative, and during that data collection period, or maybe within the analysis, they discover, or the team discovers, oh wow, we could answer other research questions with this data set. And so that's certainly something that occurs as well. So essentially, the primary data is the first collection, if you will. So where a research team conceives of and develops a research project, they collect the data designed to analyze a specific question. And then the secondary data would be, or the analysis associated with that would be where another researcher, for example, finds that this data set exists. They have research questions that could also be answered with it. So therefore, it's a secondary data analysis. So I hope that that may clear up that or clarify the difference between primary data and secondary data. But in either case, the same data set is serving the researchers, if that makes sense. Let's talk about some data sources. We discussed this briefly in orientation. So in this day and time, we have a lot of information that's being collected by way of EHRs. And a lot of data lives in those systems, if you will. We have more technology related to sensors and the capability to track more data, much of which may be healthcare related or physiologically related through sensors. We have lots of data in GPS systems. We can often explore and study resources in certain areas, whether they be healthcare related resources, education resources, nutritional resources, etc. Social media produces a great deal of data that can be mined for certain, to look for certain ideas or themes. Genetics and the testing that's going on with that is creating a great deal of data. Financial data is another source, and then weather and environmental data. So this is not necessarily a comprehensive list, but some of the more common sources that can be used in secondary data analysis. We can look at Medicare claims use files. The CDC has a tremendous amount of data, and they have data sets that are available for you to review. AHRQ, the National Science Foundation, NIH has clinical registries, and of course state health departments. So in your assignment that you'll be engaged in during this module, you will be sort of pointed to those resources so you can explore and see what's available to you. Now I wanted to speak a little bit about the this data trilogy here, and we mentioned this very briefly again in orientation, but I just want to demystify what these terms mean, because we see these terms more commonly used in literature in nursing at this point in time because of the era in which we're in with all of this information, all of this data. So data, big data rather, is pertaining to electronic data sets that are so large or complex that we have to have software or hardware in order to manage these. The term data science is related to an interdisciplinary field that studies the processes, systems that are used to extract knowledge or to gain insight from that data. And then data analytics is the science of reporting and analyzing raw data for the purpose of drawing conclusions. So I just wanted to try to clarify those terms, because it's very likely that you'll see those terms when studying this topic. Now I'm going to speak a bit about big data here. There are a number of drivers that are pushing us in this direction. Certainly, the HITECH Act and meaningful use, the mandates that are surrounding the use of electronic health records are driving a lot of this big data and the studies that are going on around it. Accountable care organizations. We have a lot of advancements in technology which have we've been able to increase CPU speed, and at the same time the cost of memory is going down. So just the hardware that can be used in this is becoming more affordable and easier to access. Architecture of these databases changing and becoming easier to use, or again easier to access the infrastructure there. Cloud computing and wireless technology, those things are becoming, or certainly we're able to access those things, again facilitating this type of work. Mobile health, speaking again of sensor technology and all that we have going on in that realm, all of the data that we can collect from smartphones. So we have data coming from different places, and then we also have things changing in the environment that again are facilitating this. So there's some benefits to big data. Certainly being able to understand more about patterns that are hidden in data that we would otherwise not be able to learn. We wouldn't be able to see it. We're able to extract new knowledge from large complex data sets, and then the generalization of patterns and new knowledge to predict outcomes. Now I want to speak just a little bit about data science in nursing, because this is an area that is growing. We see a lot of data being used collected really, and then used in dashboards, clinical dashboards. So the data that's being collected, entered into an EHR system, we're trying to make sense of it, where we can see trends and patterns in our patients and begin to act upon that. And sometimes, hopefully, before things get to a point where we can't really act in a positive way, a proactive way, so to avoid the reacting, I guess. We're also seeing where data is driving diagnoses. Data science is helping us to optimize best practices, maybe in the case of clinical pathways. We're seeing data science used in comparative effectiveness trials. We're seeing data science used in the prediction. And then we're also seeing data science used in genomics or personalized precision medicine. Now, there's a lot that goes into data science. And so becoming a data scientist does not occur overnight. We have, I have this image that was put together by a blogger on becoming a data scientist. And you can see the link there below. Basically, this is sort of their idea of what would go into a curriculum, and they're using a Metro map kind of visualization to describe it. So the areas in which one would need to become skilled and knowledgeable would be related to the fundamentals of data science. When they start this journey, statistics is a big part of this, programming, so computer programming, machine learning, text mining, data visualization, and we'll talk about that some in this course, big data, data ingestion, and then just the toolbox of skills that one would need to. So I just thought this was sort of an interesting visualization that describes all of the things that go into data science. So you can see just from this image alone, it usually takes a number of people to really be involved in data science and then data science teams. So I wanted to speak with you as well about Module 3, what it looks like in the course, and to hopefully clarify. So we'll look at the course and then Module 3. So the information, the module, you'll see here with your reading assignments. Of course, you have again the notes pages from the book publisher. Now there are a number of articles that I have linked here in this module. I understand that it may not be possible for you to read all of them, and I would not necessarily expect you to. But and I do not have them in any special order. But you may want to glance at them and see. I'll open up a couple just to kind of give you an idea. But these explain what secondary data analysis is, if it's useful and valid. And then, should some of you use this method in your research, some of these articles might be helpful to you when you go to write your proposal. So here's one on comparative effectiveness research methodology using secondary data, a starting user's guide. So I was looking for articles that would help describe the process, help someone who's new in terms of working with secondary data. Here's one related to informing health services research and policy. Reusing data, so again, another explanation of what this is and the significance of it. There are a couple that are older, and you'll see that in, like, this is 01, I believe, 03, excuse me. And the reason I included some of these older ones is because we started using secondary data analysis in nursing research a number of years ago. You can see this is 1993. And some of those articles offer a very good explanation because, again, it was early on in the discipline, you know, the use of this type of method, and so they offer a really good explanation of it, an explanation you probably wouldn't see in something that's written today, in which one uses secondary data analysis. So again, just have a look at some of these. I'm not pulling up all of them. I know you can look at them on your own time, but these are some good good articles that were chosen to hopefully help you. Now, in the assignment, go back to the module real fast to make sure I haven't missed something. Okay, yeah. So you will have a Flipgrid, the video seminar presentation that you'll have to respond to, and then your assignment is the secondary data analysis project. The directions are here. You will choose from some data sources, and I'll go back to that those links here in just a second, that are found in the module and the supplemental resources to help you maybe gain some information about relevant data and statistics that support either the need for your research or answer something for you that you're thinking about related to what you plan to do. So I realize that you may not have your research question finalized yet, and I wouldn't expect anybody to. Your idea may change between now and the time that you actually begin to put your proposal together. That's certainly to be expected. But this is just sort of to get your feet wet, to begin to see what is available, the amount of data that's just free that you can access. And so you will peruse those and figure out what you want to use. You're going to use these data sets to explore. Again, you're going to complete a secondary data analysis report about 3 of the data sets that you explore further. This is what that looks like. And you'll download 3 search queries, because most of these databases you're able to query them in some way. You'll download those, save them as Excel files. You'll submit the secondary data analysis assignment report in the 3 Excel files. There's a rubric that is associated with this as well, and I hope you can see that. And then I'm going to go back to the supplemental resources for you. So there are a number of places that you can go, and even within these links are more. Here's one about weather, even economic data, world value survey, Twitter, using Twitter. So it speaks to a number of things. I also wanted to draw your attention to the state public health data that's usually readily available by state. So I've only included Alabama on this list, but you can certainly do a search for the state in which you're interested in doing research. If there is a particular state that you're going to be doing research in, more than likely, feel free to contact me about that. If there's something that you know of, if there's a resource that you know of that's not on this list, contact me about that, and we'll discuss it and see if it's relevant for this assignment. The CDC also has states, stats of the states, and so you can find other states as well. But you can look here and see the diabetes rate. So you can download the data. That'll download into a CSV file. You can save it as Excel. So you can begin to look at these different sources and see if there's something relevant to your work, the study that you think you're going to do, or the area in which you think you're going to engage, and see what might be relevant to you. So this is, again, just to help you get started, to help make you aware of what's available, and to just get some exercise in doing this. So I hope that clarifies what's expected for this module and the assignment for Module 3. If you have any questions, please feel free to contact me, email me through course email or my email address, and I will be happy to talk to you. I look forward to reviewing your work. Take care.